Dear friends, I am Dr. Shekhar Srivastav and I am a Senior Orthopaedic Consultant at Sant Permanent Hospital. Stability in the shoulder joint is mainly maintained by soft tissues, not by bones. So these soft tissues are under constant amount of stresses. So the problems are peculiar to shoulder joint, such as repeated dislocations of the shoulder joint. There can be damage to the tendons or the muscles of the shoulder joint leading to tendinitis. There can be arthritis of the shoulder joint, which can be because of damage to the cartilage, or there can be a very special problem seen only in shoulder, that is frozen shoulder. Dislocation of the shoulder, in which the shoulder head comes out of the socket. Now once it has happened because of trauma, it has a tendency to dislocate repeatedly. Apart from that, there can be a rupture of tendons or muscles that can lead to pain and weakness, and the person cannot pursue sports or vigorous activities. There can be wear and tear of the muscles of the shoulder joint, or which we commonly call as rotator cuff. So there can be swelling of this rotator cuff, or there can be tear of the rotator cuff. This leads to pain, stiffness. It affects patient's sleep. Patient cannot sleep on the same side. One very common problem seen in elderly is frozen shoulder, in which there is gradual decrease in the movement of the shoulder joint. Then in elderly there can also be arthritis or osteoarthritis of the shoulder joint. There is gradual stiffness of the shoulder joint, so the movements become restricted and then they also become painful. Initially the patient has pain only while moving the shoulder, but gradually what happens that the patient develops pain even at rest. It even disturbs patient's sleep. The treatment for frozen shoulder initially is conservative. That means the patient is given medications, the patient undergoes physiotherapy, exercises to increase the movement of the shoulder joint. Now in some situations we even inject in the steroid in the shoulder joint that reduces the pain, and that also helps in gaining the movement. In very severe cases where the patient doesn't improve with all these treatment modalities, there we go for surgery. Previously the surgery was open surgery, in which the joint was opened and the treatment was done. Now to reach the joint one has to cut the skin, muscles, so that frequently led to pain and stiffness later on. But now the treatment has changed. Now the joint is not opened but only small keyhole incisions like the tip of this pen. So these small incisions are made through which camera is inserted into the shoulder joint. The problem is recognized, and through another keyhole incision instruments are passed and the treatment is done. The cartilage of the shoulder joint is affected. It can be because of osteoarthritis, which is age-related process. It can be because of trauma, where the cartilage is totally destroyed, or it can be because of rheumatoid arthritis. So in all this problem, the shoulder joint is damaged, the cartilage is damaged. The patient finds it difficult to move their joint, the joint becomes stiff, it becomes painful even at rest. Now shoulder arthritis is mainly treated initially by exercises. If the patient doesn't feel better, then one can give intra-articular injections, where the injection is given inside the shoulder joint. If the arthritis is very severe and if the patient is not getting benefit by medicines or injections, then surgery is needed. For shoulder arthritis, the treatment, the surgery usually is replacement of the shoulder joint. If you have a problem, instead of just letting it linger on, you contact an appropriate doctor, your family doctor, who can advise you to go to the specialist, and your treatment can be tackled.